Hey everyone, it's Dr. Mike, and welcome back to the channel. Turmeric is a spice used for centuries in traditional medicine. It contains curcumin, known for its health benefits. But turmeric can interact with certain medications. Just like some foods, turmeric can have unintended consequences with specific drugs. We'll discuss drugs to avoid with turmeric and who should be cautious. Always consult your doctor before making changes to your diet or supplements. Now, let's get started. Let's talk about blood thinners. Blood thinners prevent clots, reducing stroke or heart attack risk. Now here's where turmeric comes in. Turmeric's curcumin also thins blood by affecting platelet aggregation. Combining turmeric with blood thinners can enhance effects, risking excessive bleeding. Consult your doctor before adding turmeric if you're on blood thinners. How do you know if you're experiencing excessive bleeding? Look out for easy bruising. Bruises that are larger and more pronounced, prolonged bleeding from cuts or wounds, frequent or prolonged nosebleeds, bleeding gums when you brush or floss. These signs can indicate other health conditions. Consult your doctor if you notice any symptoms. Now, I know some of you might be thinking, but Dr. Mike, I only use a tiny bit of turmeric in my curry or smoothies. Surely that's not enough to cause any harm. And you're right. Small amounts of turmeric used in cooking are unlikely to cause any significant interactions with blood thinners. However, when we talk about turmeric supplements, the doses of curcumin are much higher than what you typically consume in your food. And it's these higher doses that can potentially lead to interactions with medications. That's why it's always best to err on the side of caution and consult your doctor before taking turmeric supplements, especially if you're on blood thinners. Remember, your doctor has access to your complete medical history and can provide personalized advice based on your individual needs and risk factors. They can help you weigh the potential benefits of turmeric against the risks and determine the safest course of action for you. So, the bottom line is this: if you're on blood thinners, don't self-medicate with turmeric. Talk to your doctor before adding turmeric supplements to your regimen. Your health is worth it. Let's talk about how turmeric can interact with diabetes medications. Diabetes affects how your body regulates blood sugar levels. People with diabetes either don't produce enough insulin or their body doesn't use it effectively. Turmeric has been studied for its potential to help regulate blood sugar levels. Combining turmeric with diabetes medications can lower blood sugar levels too much. This can lead to hypoglycemia, causing dizziness, confusion, and fainting. Talk to your doctor before adding turmeric to your diet if you're on diabetes medications. Now let's delve a little deeper into hypoglycemia and why it's a serious concern. As mentioned earlier, hypoglycemia occurs when your blood sugar levels drop too low. This can happen for a number of reasons, including skipping meals, exercising more than usual, or taking too much diabetes medication. When your blood sugar levels drop, your body doesn't have enough glucose to fuel its essential functions. This can lead to a range of symptoms, some of which can be quite alarming. Mild hypoglycemia might manifest as feeling shaky, weak, or dizzy. You might also experience increased hunger, sweating, or a rapid heartbeat. However, if left untreated, hypoglycemia can progress to a more severe state. You might experience confusion, difficulty concentrating, or even behavioral changes. In extreme cases, severe hypoglycemia can lead to seizures, loss of consciousness, and even coma. That's why it's crucial to recognize the symptoms of hypoglycemia and take prompt action. If you experience any of the symptoms mentioned earlier, it's essential to consume some form of fast-acting sugar, such as fruit juice, glucose tablets, or hard candy. Now, if you're on diabetes medication and considering adding turmeric to your diet, it's essential to work closely with your doctor. They can help you determine a safe dosage, if any, and monitor your blood sugar levels closely for any potential interactions. Regular blood sugar monitoring is crucial for everyone with diabetes, but it becomes even more critical when you introduce a new supplement like turmeric. Your doctor may recommend checking your blood sugar levels more frequently, especially when you first start taking turmeric or adjust your dosage. This will help them identify any patterns or fluctuations in your blood sugar levels that could indicate an interaction with your medication. Remember, managing diabetes effectively requires a multifaceted approach. It involves following a healthy diet, engaging in regular physical activity, taking your medications as prescribed, and monitoring your blood sugar levels regularly. By working closely with your doctor and being proactive about your health, you can safely enjoy the potential benefits of turmeric while effectively managing your diabetes. Hey everyone, it's Dr. Mike, and we're back with our series on turmeric interactions. In this chapter, we're diving into a topic that might surprise you, the combination of turmeric and antacids. Now you might be thinking, antacids? What's the big deal? Well, antacids play a crucial role in managing stomach acid, something that's essential for proper digestion. Imagine your stomach as a powerful machine, breaking down food with the help of acidic gastric juices. When we experience heartburn or acid reflux, it's often because those gastric juices are a bit too enthusiastic and flow back up into the esophagus. That's where antacids come in, acting like a neutralizing buffer to calm the burn and restore balance. But here's the catch. Turmeric, particularly its active compound curcumin, can also influence stomach acid production. So, when you mix turmeric with antacids, you're essentially juggling two forces that directly impact your digestive system's delicate equilibrium. Now, let's break down the interaction between turmeric and antacids. Turmeric, especially in supplement form, can increase stomach acid production in some individuals. This might sound counterintuitive, but remember, our bodies are complex. On the other hand, antacids are designed to neutralize stomach acid, alleviating symptoms like heartburn. So when taken together, turmeric might be working against the antacids, potentially reducing their effectiveness. Imagine you're trying to fill a bucket with a hole in it. The antacids are like your hand, constantly pouring water, neutralizing acid, into the bucket. Turmeric, in this case, is subtly widening that hole, making it harder to maintain the desired water level, balanced stomach acidity. This interaction can be particularly concerning for individuals who rely on antacids to manage chronic conditions like GERD or peptic ulcers. Their symptoms might not be adequately controlled, leading to discomfort and potential complications. So, what does this mean for you? Should you avoid turmeric altogether if you take antacids? Well, it's not that simple. The key is awareness and communication with your healthcare provider. If you're taking antacids occasionally for mild heartburn, incorporating turmeric in your diet through food is unlikely to cause significant issues. However, if you rely on antacids regularly or are considering turmeric supplements, it's crucial to consult your doctor. They can help assess your individual risk factors, medication regimen, and advise on the best course of action. This might involve adjusting the timing of your antacid and turmeric intake, modifying dosages, or exploring alternative options for managing your condition. Remember, everyone's body is different, and what works for one person might not work for another. Open communication with your healthcare provider is essential for ensuring your safety and well-being. Stay informed, stay safe, and I'll see you in the next chapter. Chemotherapy is a powerful treatment used to combat cancer. It targets rapidly dividing cells, including cancer and healthy cells. This leads to various side effects. Combining turmeric with chemodrugs requires caution. Turmeric has active compounds like curcumin that impact the body. Curcumin might interfere with chemotherapy effectiveness. It could reduce the effectiveness of cancer treatment. Always consult your oncologist before adding turmeric. Here's the thing about chemotherapy. It's all about precision. Oncologists carefully select drugs and dosages to target cancer cells effectively. Adding turmeric to the mix can throw a wrench in this delicate balance. Think of it like this. Some studies suggest that curcumin might alter how the body metabolizes certain chemo drugs, meaning the drug might be broken down too quickly or too slowly, affecting the overall efficacy of the treatment. In other instances, curcumin might actually enhance the effects of certain chemo drugs, leading to an increased risk of side effects. While this might sound like a good thing, having more of a drug in your system than intended can put unnecessary stress on your body, especially when it's already fighting cancer. This potential for interference is precisely why open communication with your medical team is essential. They know your medical history, the specific chemo drugs you're on, and can provide personalized advice based on your unique situation. Navigating cancer treatment is already a challenging journey, and adding unnecessary risks is the last thing anyone needs. It's understandable to be curious about natural remedies and supplements like turmeric, especially when you're looking for any source of support during chemo. However, it's important to remember that even natural substances can interact with medications, sometimes in unpredictable ways. Turmeric is no exception. While it has its benefits in some contexts, it's not a magical cure-all, and it's definitely not worth jeopardizing the effectiveness of a potentially life-saving treatment like chemotherapy. So here's the bottom line. If you're considering using turmeric while undergoing chemotherapy, please talk to your oncologist. They can help you weigh the potential risks and benefits based on your specific situation, ensuring that you're making informed decisions about your health. Remember, your medical team is your biggest advocate during this time. Don't hesitate to ask questions, raise concerns, and be honest about any supplements or alternative therapies you're considering. Open communication is key to a safe and hopefully successful treatment journey. Pregnancy is such a special and transformative time in a woman's life. As a doctor, I've seen firsthand the incredible strength and resilience of expectant mothers. Now, when it comes to pregnancy, it's no secret that women become extra cautious about what they eat, drink, and expose themselves to, and for good reason. Everything a pregnant woman consumes can potentially impact the developing baby. While turmeric is generally considered safe in moderate amounts in food, the conversation changes when we're talking about supplements, especially during pregnancy. Turmeric supplements often contain much higher concentrations of curcumin than you typically find in food. And while curcumin has shown potential benefits in some areas, research regarding its effects during pregnancy is still limited. This lack of extensive research is why, as a precaution, most healthcare professionals advise against using turmeric supplements during pregnancy. Remember, with a precious life growing inside you, it's always better to err on the side of caution. Now, you might be wondering, what are the specific concerns with turmeric supplements during pregnancy? Well, some studies suggest that high doses of curcumin might potentially stimulate the uterus, which could increase the risk of premature contractions. While these studies are not conclusive, the possibility of such an effect is something we need to take seriously, especially during the delicate stages of pregnancy. Remember, our primary goal is a healthy pregnancy and a safe delivery. Additionally, there's limited research on how curcumin from supplements might impact fetal development. While some studies suggest that curcumin could have beneficial effects on fetal brain development, more research is needed to confirm these findings and rule out any potential risks. So, until we have a clearer understanding of how high doses of curcumin affect both the mother and the developing baby, it's best to stick with moderate turmeric consumption through food, where the curcumin levels are much lower. I know it can be frustrating when you're pregnant and have to be extra cautious about everything, but trust me, it's for the best. Your healthcare provider is your best resource when it comes to making informed decisions about your diet and any supplements you might be considering. They can assess your individual health history, any potential risks, and guide you towards the safest options for both you and your baby. Remember, every pregnancy is unique, and what works for one person might not be suitable for another. Open communication with your doctor or midwife is crucial throughout your pregnancy journey. So, if you have any questions or concerns about turmeric or any other aspect of your diet, don't hesitate to reach out to your healthcare provider. They're there to support you every step of the way. And that wraps up our discussion on the drugs you should never combine with turmeric without first consulting your doctor. Remember, turmeric is a potent spice with active compounds that can interact with various medications. While it has its health benefits, it's crucial to prioritize your safety and consult your doctor before adding turmeric to your diet, especially if you're on any medications. Thanks for watching. Don't forget to subscribe to our channel, like, share, and comment on this video. Stay healthy and informed.